December is considered the most wonderful time of year. We hope that it has been for you and your family, but doctors do warn it's also a deadly time when heart attacks are the most common.
That's why we want to let people know that you can protect yourself. Our 9 News medical expert, Dr. Payal Kohli, with us. Of course, she is a cardiologist. What about the warning about this time of year from the American Heart Association? What does it mean? What do people really need to hear?
You know, we've known this for quite some time, but it's something that a lot of us are not aware of. But December 25th is the deadliest cardiac day in the entire year, meaning you're most likely to die of a heart attack, stroke, or other heart-related cause, followed by December 26th as the second deadliest, and New Year's Day as the third.
Do we have a why that we can attach to that?
You know, we don't know, and for the longest time we actually thought it was related to the cold weather. So we said, okay, well, the weather gets cold, inflammation kicks off, maybe our blood pressure changes, cold air can trigger things, you know, with our breathing. But we see it in places like LA, where the weather is not cold. We see it in the southern hemisphere, New Zealand, occurring in December, where it's summertime. So now we really realize that it's more behavioral. It's what we're doing. It's how we're responding to the holidays. It's our actions that are driving this.
Yeah, the sheer stress. Look at the airport we just saw with, Courtney. That can do a lot in itself.
So stress is probably the biggest piece of it. So stress triggers cortisol, cortisol triggers inflammation, inflammation triggers heart attacks. And so we have to work on our holiday stress. But other things that we do as well, such as changes in our diet. I mean, December is the time of year where we change our behaviors dramatically. We eat a lot more, we drink a lot more alcohol, we sleep a lot less, we exercise a lot less, and God forbid we feel something, you know, we blow it off, or we attribute it to something else, or we don't want to mess up our family gathering, so we don't seek medical care.
So this is why doctors aren't very popular. You're saying we should not enjoy all of the treats and all of the time together with our family and friends. We have to treat it, you know, have a salad, have some kale, don't have
No,
cookies.
absolutely not enjoy, but enjoy in moderation and enjoy with damage control. So here's what I would recommend, is that if you do indulge in your Christmas dinner, the next day you have to be a little extra careful in terms of eating more potassium because you've just had a bunch of sodium the night before. If you've had more alcohol than usual, drink a lot of water the next day to help flush out some of that alcohol from your system. So you really want to try to do it in a way that doesn't cause permanent damage. And in fact, the data tells us that we gain usually about 2 to 3 pounds over the holidays, but we only end up losing 1 or 2 of those. So every year, we're adding a couple of pounds at the holidays. So okay to have fun, but try to do it in a way that's heart healthy, that's responsible. Don't miss your medications. Just stay on top of everything.
And I wonder, as we head into the new year resolutions, all those things are going to be coming up. Is it important to get your physicals and your yearlies at the start of the year?
You know, that's a really great idea, because a lot of times that you make your resolutions, your deductibles reset as well. So it's a really nice time of year to do all your healthcare planning and figure out what your healthcare spending is going to look like for the rest of the year. Make a good plan and stay with it. And really, like I said, it's most important to make sure for your personal life that you modify your diet, your alcohol patterns, and all of those. There's in fact a phenomena called holiday heart, which I see at least 4 or 5 cases after the holidays. I'm expecting to see some this week, where young people, 20s, 30s, and 40s, no known structural heart disease, meaning they're healthy, come in with electrical problems, arrhythmias with their heart. And it comes from alcohol use, and it was first described in the 1970s. So holiday heart is a very common phenomenon, in fact, a disease. I
was kind of hoping you were going to go with the old snow shoveling thing that old guys like me shouldn't shovel.
What? Are you calling yourself old?
That should be good for the heart. Get out there and
shovel.
So warm up, Tom. I want to see you warming up before you get out there.
Not the help I expected from you, too. Dr. Kohli, it's good to see you. If we don't see you, Happy New Year. We'll see you next year.